So thank you very much for the invite to come and speak to you today about antimicrobial resistance and what we can all do to help, because it's one of those issues which is everyone's problem, if that makes sense. So from that perspective, I'm just going to talk quickly about what is antimicrobial resistance and what it means to us, what the government action around this issue is at the moment, and our role then in trying to tackle antimicrobial resistance. So I was going to say first, what is a microbe? So a microbe is a types, for example, bacteria, fungi, things, they live everywhere. Some are good, some are bad, but they're all around us all the time. But what is antimicrobial resistance and how does it happen? So basically, resistance is when a microbe becomes resistant to the treatment that we normally use to treat an infection. And it normally means that that treatment won't work anymore. And it means then that you have to use another treatment then to treat that infection. And the problem that we have is that resistant microbes can actually spread from one person to another person who already carries that resistant bug. And then that resistant bug then can cause an infection in another person. So how it happens, the diagram we've got there, we've got, as I said, there's lots of germs around and a few of them are drug resistant. So when you have a look at the picture there, it's the kind of pinky purpley one are the resistant organisms. So then when you take an antibiotic to kill a bacteria that's causing an infection, what happens then is that antibiotic then kills the bugs that are causing the infection, but also kills some good bacteria that protects the body from infection. And what happens then is what's left behind then is your drug-resistant bugs. And once they're there by themselves, they're allowed to grow and take over. So they become kind of the predominant bug in your system, if that makes sense. And then when you have another infection, it may be more difficult to treat because you've then got a resistant bug in your system. And what the problem we have as well is that bacteria are very clever, and sometimes they can talk to each other and pass the resistance mechanism from one bacteria to another. So that bug may not have seen an antibiotic, but it's been told by another bug how to become resistant to that antibiotic. So what is an antibiotic? So we're talking here about bacteria now. And basically antibiotics are drugs used to treat infections caused by a bacteria. So if you're taking an antibiotic, it won't work against things like viruses. And the picture we've got there is for Alexander Fleming. So I'm helping Lawrence here with his Scottish theme. So Alexander Fleming was a Scottish physician and microbiologist, and he discovered penicillin. When some people may think, oh, resistance is a new thing, but it's not, because this is a quote directly from Alexander Fleming himself that says, "The thoughtless person playing with penicillin treatment is morally responsible for the death of the man who succumbs to infection with a penicillin-resistant organism." So this is not a new issue that we're thinking about. Alexander Fleming thought about this very soon after discovering penicillin itself. And from that perspective, then, this is an issue that everybody knows about. But when you think about it, when penicillin was discovered by Alexander Fleming, it was a life-saving treatment. So people were taking antibiotics to save their lives. And then this is Charles Darwin. And he said, "It's not the strongest of the species that survives, nor the most intelligent. It is the one that is most adaptable to change." And that's the problem that we have at the moment, is that the bugs around us are actually cleverer than us at the moment and are able to adapt and change quicker than we are to develop new antibiotics. So what does resistance actually mean to us? Most of the data that we have at the moment, so the better data that we have at the moment, are back from 2019, because obviously in 2020 we had the little issue of COVID coming along, so people got sidetracked by COVID at that point in time. But AMR, or antimicrobial resistance, is already a leading cause of death globally. And in 2019, it was estimated that 1.27 million deaths were caused by antibiotic-resistant infections. And when you compare that to around 860,000 for HIV and AIDS, 700,000 for breast cancer, and around 650,000 for malaria, it's already a leading cause of death. And there's already been estimates done that if we continue on the same track as we are at the moment, that by 2050, that globally there will be 10 million deaths attributable to antimicrobial resistance every year in the world. And it will overshadow then cancer, which at the moment is around 8.2 million. And when you think of it in a bigger picture, so when you look at what the WHO quote at the moment as how many people they think that have died from COVID so far since the start of the pandemic, they talk around just over 7 million at the moment. But we're talking about 10 million every year dying from antimicrobial resistance if things don't change. So as mentioned, it's already directly affecting us in the UK on an everyday basis. It's already causing people to suffer longer infections that are more difficult to treat. It means then that we're needing to use other treatments which may have more side effects or may not be as effective. The risk of antimicrobial resistance makes things like surgery in the future and chemotherapy actually more risky because we won't have the antibiotics to prevent infection after surgery and when you're having chemotherapy. So it just makes those procedures more difficult. And basically, if it continues to spread, some infections that in the UK we would normally think are simple to treat with an antibiotic may actually become more significant causes of illness and could even cause death. So from the perspective of antimicrobial resistance in the news, Dame Sally Davis, one of the chief medical officers, she was the chief medical officer before our current chief medical officer, Chris Whitty, and she mentioned that there are few public health issues of potentially greater importance for society than antibiotic resistance. And that was back in 2013. And it was only last week, I think, where she mentioned that superbugs will make COVID look minor compared to antimicrobial resistance. David Cameron then was the then Prime Minister back in 2013, and he said that if we fail to act, we are looking at an almost unthinkable scenario where antibiotics no longer work and we are cast back into the dark ages of medicine. And at that point in time, that they put antimicrobial resistance on the risk register and saying that it was as big a risk to the population as terrorism was. And it's continued to be in the news since then. And they talk about things like routine surgeries and minor infections could become life-threatening again. So it's always in the news and it's quite often talked about, but what are we doing about it is the honest answer. So David Cameron, when he was the then Prime Minister, commissioned a report on antimicrobial resistance by Professor Jim O'Neill. And from that then, they developed a 5-year antimicrobial resistance strategy that ran from 2013 to 18. Then in 2019, then the UK government developed a 20-year vision, and from then has been actioning 5-year national action plans since then. And the snazzy one with the pictures on the right-hand side is the one that was published at the beginning of this month, which is the new National Action to 29. And it tasks UK government and all the devolved nations of the UK to try and tackle antimicrobial resistance from both a population basis and also in the animal health and in the environment as well. So one of the things that they talk about a lot in the National Action Plan is engaging with the public and also about antimicrobial stewardship. And I think a simple way of describing it is taking care to use our antibiotics properly. So it's giving the right antibiotic to the right patient at the right time. And when we do it, we give it at the right dose, using the right route, and trying to cause the least harm to the individual patient, but also to future patients as well. So what can we do individually to fight antimicrobial resistance? So one of the biggest things we can do is to try and prevent infections to begin with. So if you don't have an infection, you won't need antibiotics to treat them. And one of the biggest things that we can do is stay up to date with vaccination. So if you try and stop yourself from getting an infection by having a vaccine, then that lowers your need to have an antibiotic to begin with. We can also do things from a self-care perspective to try and stop infections from spreading. So during COVID, everybody was very keen on their hand washing. And I think probably we're slumping back a little now and we need to get more active with our hand washing. So hand washing after being to the toilet, before you eat anything, if you blow your nose, just making sure that your hands are clean as often as possible. When you're coughing and sneezing, to try and use the right etiquette, so try not to try and stop spreading it. So during COVID, they were telling people to cough into a tissue, into their arm, or anything to try and stop the spread of infection. Maintaining hydration is also very important. So we know that people who are dehydrated are more at risk of having urinary tract infections. And if you're hydrated as well, your immune system is better as well. And having good skin barriers as well. So if you've got breakages in your skin, that means you're more at risk of getting an infection as bugs get into the system through your skin. So having healthy skin is also very important. And from a lifestyle perspective, maintaining a healthy lifestyle from the perspective of diet and weight, and smoking and alcohol is also very important. So trying to have a healthy diet, maintaining a good weight, avoiding smoking and excessive alcohol where possible as well. There are a lot of infections that we call self-limiting infections as well. So these are infections that your body can usually fight on their own. A lot of these are viral infections, but can also be caused by bacteria. But actually, you don't need antibiotics to treat these type of conditions because your body can fight them on their own. And actually, taking antibiotics can actually make things worse from the perspective of sometimes you get these unwanted side effects such as thrush and diarrhea and vomiting. And the Target website has a lot of fantastic resources that patients and clinicians can use with their patients as well about how they can manage their common infections. And that includes things like cough, cold, sore throats, and ear and eye infections as well. And it just basically gives you basic advice about how you can treat your common infection, but also then how long infections normally last. So a lot of people are quite surprised to hear that cough can last up to 3 weeks or 21 days. So it's not abnormal for somebody to have a cough and that it lasts for 3 weeks. It doesn't mean necessarily that you need to have an antibiotic. And it's working with your healthcare professional as well. So understanding that when your healthcare professional speaks to you, that antibiotics may not always be needed for an infection. It's knowing how long your infection is likely to last and knowing when you need to go and see your healthcare professional if things worsen or certain symptoms arise. And after our talk from Lawrence as well, knowing about your allergy history as well. And it's understanding the difference between an allergy and a side effect. So some people will think that having a bit of diarrhea after an antibiotic is an allergy, but it's actually a side effect from that antibiotic rather than an allergy. We also have national campaigns every year. So European Antibiotic Awareness Day is on the 18th of November, and World Antimicrobial Resistance Awareness Week runs from the 18th to the 24th of November. And it just gives us a chance to promote antimicrobial stewardship and raise awareness about resistance with the public, clinicians, and policymakers. And what we do is develop a lot of assets and share them then during that week. And these are just some examples of the assets that we've developed. And it's things we've got things on Facebook, Instagram, and Twitter, or X now we call it, not Twitter anymore, isn't it? And that from that perspective, we engaged as well with our younger population last year using things like TikTok and Instagram as well. And we worked with Welsh Government and the National Library for Wales and lit up some of our buildings blue to promote antimicrobial resistance last year. So I suppose my plea to you is to help us spread the word about antimicrobial resistance and share those messages during those campaign weeks. Another thing you can do is to sign up to become an antibiotic guardian. You've got the hyperlink there to the Antibiotic Guardian website. And what it does is it's actually a call of action, and people can pledge what they're going to do to try and help reduce antimicrobial resistance in the UK. And then for those of you with children or grandchildren or with godchildren or any children from other friends as well, there's a resource called eBug. And basically it runs from foundation year, so from primary school to secondary school children. And it teaches them about antibiotic resistance. It teaches them about infection and prevention control as well. So you've got the picture there of the giant sneezes, what you should be doing if you're sneezing. And what's very important about this is that we need to engage with our future generations, because that's where the problems will lie if we don't make the changes now. It's our future generations that will suffer if we don't act now to try and prevent antimicrobial resistance becoming a bigger issue. So this is just a wonderful resource that people can access and play games and engage with children about antibiotic resistance and teach them about it. So what are my take-home messages about antimicrobial resistance is that we must use what we have left wisely, because the antibiotics that we have, we need to use them wisely to protect future generations, and that we all have a role to play in this. So it's everybody's business, and hopefully we can all work together to try and fight antibiotic resistance. Thank you very much.